guys actually do the test with. And it's the last set that we haven't opened, so I'm going to let you guys use those for last time. This is what it looks like. Pass that around. Take a look at it. You also have the valve, but for the purposes of the test, it's going to be in this. Okay, so it's just going to be a little bowl of valves there. You guys will each take one for your kit. It's not in the kit, so you guys will be able to take one of those with you. This is what it would look like in a hospital. We aren't going to have them like that anymore because we could just reuse them. And those things are expensive. Those things are like $7.50 a piece, $10 a piece, something like that. Just ridiculous. We were looking at different things today. So like you guys know the cleaning solutions you guys use on for the IV insertion. We found like one I had been looking for some prices on those, and there's like one that costs like $3,000 for a single wipe. Yeah, it's like surgical.
What?
Material. Yeah,
That's crazy.
Yeah, we're getting those. This is what it would look like. Yeah. You guys would also going to need a 60 ml syringe. This one's actually in the package. What you guys will find will be in here. Okay, so each of you can grab one of those. You're also going to need your, what kind of water-based, water-soluble?
Steven?
Yes.
I don't think you have a type though.
Oh, Salem Sun. Salem's right. Nice.
Oh, Salem
It
Sun.
is in the reading guide.
Oh, on the side
No,
it says
it's
Salem Pump.
No,
Yeah,
it's in the
I
reading
know.
system.
I thought I was right.
It's
I confused myself. It's a sub pump.
It's a pump with a lid.
Like in the basement.
Yeah.
That's not.
So right, so you got the lubrication, right? And then we're gonna have, this is your MSS basin. There are only 6 of them, so you guys are gonna have to share these when you're practicing, okay? I don't know what tape's in here, but you don't need tape. These are your practice ones. I'm gonna pass that around to see what it looks like. And you can see how it, on the top part here, this fits right over the nose like this. And then this part down here will just wrap around the tube. So you guys,
That's cute.
so yeah, so you take it up like this, and this is the part that wraps around the tube. And you guys can actually, when you're testing, you guys, you can actually just remove the top part, sticky part, and I'll show you when we do it here. You can just remove the top part and sticky part and put it on the guy's nose. That way you have it there ready to go when you're ready to secure it. It's a little bit easier that way to have it in place instead of trying to fumble around here. Well, because you don't want to move the tube too much, right? Once you have it in place, you want it to stay where it is. So that's those. This is just some examples of like stuff that I got at Walgreens. They're just like Band-Aids, but it's the same kind of thing, and you can get them to like practice with. Yeah. So it might be worthwhile to find them to just practice with. I was telling you guys about the different types. That's the sphere tubing. So that's actually the one that fits across the lip, and you can just, it's a band that just pulls across, and you put the tube in there and pull it back across, and it sticks on there. And there's actually a couple on mannequins out there in the other room that you guys can look at if you want to. Let's see, we looked at this. Like I said, there's only a few rubber bands and safety pins in there, so you're gonna have to share with these until I get some more tomorrow. And that's all your supplies. So you got straws here. There's also cups for in the drawer over here. So if you guys need cups, there's a whole bunch of cups in here. I'm not gonna pull a bunch out, but I will get one for now so we can show you what your simulation looks like. So if we're getting all our supplies together, here's the package of the up over here. There it is. Yeah. So we got our kit. We got a securing device. We got the valve, reflex valve. We got 60 mils. I don't have my stethoscope with me, but it's around my neck. Looking very stylish. There's a stick for checking the throat. There's a straw for the cup. I think that's everything I need. A pen, indelible pen. I'm going to use it to pretend that I have a flashlight. Because my flashlight's in there. it. So remember, you guys are gonna have your kits here. There's enough for 20 bags. This is the 20th one, so whoever doesn't have one, you get this one. Okay. So not all of the patients here have noses that go all the way through, so you kind of have to like play with them out there to see which ones are going to go through. All right. This one does go through. Tissue. I'll make sure that there's tissue by each of the beds for when you guys are doing your test, right? But you're going to want to have tissue available for your person. So I'm going to put a check pad up on his shirt there. Actually, someone grab me a check pad real quick. Oh, yeah, it looks a little more realistic.
Oh. What's going on YouTube? No. I'm just
Right there, you guys.
I will post this, I promise.
I'm gonna go right up into your face. Too bad it's not a Snapchat filter.
Snapchat filter?
Yeah, Steven, do you want to use this pen light?
What's that?
Do you want to use this? It's pink. It's your color.
Thank you.
Can you have a steady video, please?
No, I'm sorry.
Optic image stabilization. Come on.
So you guys gonna do the normal cost
Yeah,
swipe,
please.
guys. Make sure that you practice the cost swipe a little bit because some people kind of struggle with that. So make sure that you get that practice in. So we're gonna get this just up here around them. So the cost swipe is right there. It's ready. Thank you, Anna. So I'm gonna go ahead and get things set up here. And of course you're talking to your patient the whole time and telling them what's going on and what you're gonna be doing, right? What else are we doing in this time? Assessing, right? So you can just, while you're talking to them and setting stuff up, you can visually look at the redness of the nose. Is he sleeping? No, he's not really sleeping. Even though his eyes are closed, he's not really sleeping.
Meditate.
Meditating.
Feeding
Yes,
hold.
there you go.
Hands up. Palms are up.
He's
Meditate.
praying. Stop.
Just waiting.
Where do we have the 60 mil syringe for?
For aspiration and air. The whooshing.
That's the first thing we're doing, our whoosh test, right?
Or whoosh.
So we're gonna pull this back a little bit. And we're gonna pull this piece out here. Any idea what this piece might be for?
Connector.
Yeah, it's our connector for when we're going for our, oh yeah,
Oh my god.
so you can go ahead and just put this right in here. That's gonna be our connector to our vacuum pump. Okay? Alright, and then I can connect this to, notice I already put out air. You only need about 30 mils of air. About 30 mils of air. Just connect this so you're all ready to go. Okay? Set this over here. I'm also going to take my valve and get that in place. The nice thing about the valve is it's color coded. So blue goes to blue, white goes to clear. So just go ahead and get that in the blue part. Yes, you don't need to push it on really hard because it's really hard to pull off. Okay, and if you like get it in too far, sometimes you try and pull it out, it'll break that blue arm off. And remember, these are like $7 a piece. Even though it's a cheap little piece of plastic. So you're gonna give this piece out here, give them their little emesis bowl in case they need to vomit or anything like that. We also have a cup with water. Alright, now we can do a little bit more of an assessment now that we're set up, right? So we can go ahead and have them say ah. And we're gonna take a look in there. Don't see any redness, so they're looking alright. Ask them if they've had any trauma or anything like that. Have you had trauma in the recent past? Have you had any septums, deviated septums? You guys can go through the whole list of stuff that you need to look for. And then I'm going to go ahead and get my Band-Aid ready. Band-Aid. My UV strip. Get your Band-Aid on.
do boo boo on your nose.
There, so just sit on the tip and it just slides right over like that. Right? And then you're all ready to go there for when you get into place and you just bend it back like that. And it's all ready to go. Then you just grab that strip when you're ready and just pull back and you're ready to go. So we are ready to go here. They have tissue, they have everything ready to go. I'm going to set this here for now. What's the first thing we want to do before we start going in? Measure. Right, so sometimes your book says to do it a couple different times. You can do it right before you go in, or you can do it like now. But to get this wrapped around your fingers like this, it just kind of helps loosen up the tubing a little bit. So it's easier to go in, and kind of gives it a little bend to it. Because when you're going in, you kind of want it to be curved to go down the back of the throat, right? So let's go ahead and measure here. So we're going to measure from the nose to the ear, and from the ear down to the xiphoid process. So in this case, about 50, right?
So do we need gloves on for the measuring and all this or no?
But no, you don't need gloves on for this. The only time I worry about the gloves is when you're ready to go in, okay? Yeah, you clean your hands when you wash in, right? Alright, so now we have our measurement, have everything ready to go. Go ahead and put on gloves because we're going to go in. We're going in. Nova Blackadder. You guys ever seen Blackadder? Oh my gosh. Blackadder is like, you guys know Rowan Atkinson? It was one of his like original comedies, and he's like this like guy in the medieval ages, and he's like this like lackey to a prince of England in the Dark Ages, and he's always like, and he gets in trouble with the prince at one time, and the prince has the executioner come in and to discipline him. The prince or the executioner comes in with a like red hot iron spike, and he says, "Bend over, Blackadder." British humor. We can grab Pam so you guys, just so I demonstrate it for you, so someone doesn't shut up. There'll be a can of Pam by the bedside or something like that. And it doesn't take much, just get a little bit on the tip like that. Okay? That's all it takes.
Is this a 30-degree angle?
This is a 30-degree angle, so we're going to want to go up a little bit, right?
With this.
Is it for
Yeah, it's in the long picture. Make sure you wrap it around your hand.
That's just looks scary.
Alright. So they're sitting up. You want to be like, you want your dominant hand to be on the side that you're going to go in, right? So if they're going in on the right nares, you're going to be on this side of the bed. Otherwise, you're going to want to be on the other side. So like I said, I like to keep the eyes a little bit covered. Have it down just like a little bit below the tip. You're going to have their head back. And you're going to get it going in until they're about 3 to 4 inches in. And then, like I said, you can kind of visualize in the back, say, I see it going in. You're not really going to see it, but just say, I see it going in. And then you're going to say, okay, I need your help now. You're going to have them tilt their head. And you're going to sip as it goes down. And you get to say, sip, sip, sip. Sip, sip. If you guys reach a point where it feels like it's struggling with you, twist it a little bit. Okay?
Where is it going?
It's going actually down into the back there. Alright, so I'm at 50. I found my spot, that's where I want to go, right? So I'm going to hold it in place, tape off of there. And then you're in place, okay? So now that we have it in place, we want to make sure that we have at least close to a right placement, right? So I'm going to take my swoosher, I'm going to take my stethoscope, and put it up underneath the clothing, right? We don't want to go over the clothing, so I'm going to get up underneath the clothing. And I'm going to get up under there, and I'm going to listen. I hear the swoosh.
Oh.
Did you hear the swoosh? That's not what it's going to sound like in a record, but you actually can hear like a little gurgle when it does that. So you say, okay, we got it in place. So So we're
Where
gonna
does
just
the end of the stethoscope go?
right over the stomach. So epigastric.
Right at the sternum where you measure?
Yeah, right about
The
the xiphoid.
xiphoid.
Right? It's just under the xiphoid. Your stomach is right kind of in the
I love
center
saying
there.
that word.
Okay. So we have this where we want it to be. One thing you can do, just to kind of keep things in order too, is to kind of put this here for now. If you're going to send somebody, like, so we want him to go to x-ray before we hook him up to suction, right? Because we don't want to be suctioning someplace where we're not, right? So you can actually insert the white tube into the end there, have the blue tube in the blue side, and you have it in place where you want to go. So we want to make sure that we have it secured. So I'm going to grab the securing device that I brought in with me. So you can actually hang this over the, like, as long as it's above their waist, you can have it up here. The reason we secure it though is because we want to make sure that if they move, it's going to be safe, right?
And is that what they use in the hospital? Or is that what we're just
Yeah.
using in
We use
lab?
Some-
paperclip
Oh,
yeah.
for safety pins.
Yep.
okay.
So, okay, really do it, yeah. There's different ways that you can do this. If you find a better way, use whatever works best for you. I just do like the simple slip knot like that. So just one end around the other, okay? And just kind of cinch it a little bit tight. I like to get this up as close to here as possible. People have different variations of doing it, but if I have it up here, that also gives more room for them to turn. So you have him turn his head, right? So you get him like, crack, you know? And just put it in through here. And flip it into place. Notice that I still have this part up, okay? Be careful that you don't get it down like that, because again, you're getting it down really close to where the stomach is, right? So try and get it to at least be resting up like that. And then say, okay, we're going to clean up here so you can get down to x-ray and get that tested. You send him off to x-ray. And we're like, yay! For the RSD, you send the x-ray, you come back, alright, we successfully got it placed, so we're going to get you hooked up to suction. So we're going to get this off of here. We're still going to leave the reflux valve in. But we are going to get this guy hooked up to suction. So this can still be like hanging there. We're going to take our suction piece. We're going to hook him up here, just like that. I like to keep this up here as much as I possibly can. Again, same kind of reasoning. You could also tuck it under the pillow. That might help secure it a little bit better. Okay? Still connected to his sleeve in case it pulls out. I'm going to set this to 40 millimeters of mercury pressure. The little valve there that you're going to be turning.
Cute.
And I go, we're already hooked up here, so we're all ready to go there. Okay? The last part of your RSD is going to be to remove it. So once you get things cleaned up here, I leave, I come back, and I come back in. You only have to do cost wipe at the very beginning and close at the very end. Okay? You don't have to do it every time that you come in. Okay? So you're going to come back in. Again, you're going to have your little blanket just in case it gets a little messy. And you're going to be talking to him. We finally got everything that we need. We're going to get you off of this and get that NG tube out. So you're going to disconnect. You're going to turn off the pressure and remove your suction. Keep your little piece with you. Okay, you guys, it's part of that kit. All right. Don't leave it in here. Keep your little connector piece with you. And for the moment, I'm going to go in there.
Do we need to do any sort of like state any assessment?
Yes. We're going to at least say that I'm going to assess the contents of the container, which I will document later. Or you could say I assess the container. It looks a little bit yellowish. There's about 40 milliliters of blah, 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 blah. Okay? 40 milliliters of blah, 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 blah.
Perfect.
That's what I put in my document.
There you go.
Blah, blah, blah,
What
blah,
Steve
Third
said.
abbreviation.
Yeah, it's their abbreviation.
I have a video to prove it.
Alright, and then we're all ready to go here. You can even give him some Kleenex if that would help. too messy. And then we are gonna just move this off
Do we
here.
have gloves on to take the tooth out?
You don't have to, I would, I mean, but you don't have to yet, cause you're gonna pull them off, and normally you would, like, wrap this up in your hand,
Yeah.
and the.
Okay.
Get this off here.
All your black hairs gone.
What's that?
Removing all the black hairs.
Yeah, exactly.
Don't
Yeah.
leave-
And then
It's a free
kinda
facial.
like pulling out the catheter, you guys, just like from down below. You wanna make sure that you're just kinda gathering it in your hand, so you're not gonna flip. And so that's another reason to kinda keep your hand here, and then you just gather it out like this, and you have it like that.
You'll tell them to breathe out or?
Yep. Yeah, it really, it's not that hard coming out, really. Yeah, it really isn't gonna cause much grief.
Feels weird.
Yeah. Have you had one?
Yes.
Yeah. Like I said, it's just.
Do you wanna gag when it comes out?
You cough when it comes out.
Okay.
Were you
Yeah.
awake when they put it in?
No.
Oh, okay.
Ooh, wow, that's lucky.
I was gonna say, that's what I wanna know about. That's all
And
I
that's
know.
it. Any questions?
I'll do it on you, Jesse.
Do
then
you
you'll
keep
know.
them upright the whole
This is
time?
like, I hate this stuff.
What's that? For the RSD, I would. I mean, you can say when you're going out, I'm gonna put you down to 30 degrees, but when you're coming back out, set them back up again. But yeah, just for the purpose of the RSD, you can leave them
Leave it
sitting
up.
up. Yeah. That makes sense?
Mm-hmm.
What do you think?
It's good. It was a perfect ending.